Hey there everyone. In the previous video we had studied about the front of the thigh. We had studied the superficial fascia, the deep fascia, its content like cutaneous nerves, cutaneous arteries, cutaneous veins, and we had studied the lymphatics, and then we had studied about the bursa, the deep bursa, the superficial bursa, then the intermuscular septum, the cribriform fascia, and a lot more with the diagrams present in it. So if you haven't seen that video, please go check out that video. And in today's video we are going to start the femoral triangle. So what is femoral triangle? It is a triangular depression. It is a triangular depression on the front of the upper 1/3 of the thigh. Okay, so the thigh, it is divided into three sections: the upper, middle, and the lower. So the upper, it's 1/3 of the thigh. The triangular depression is present on the front of upper 1/3 of the thigh, just below the inguinal ligament. Okay, just remember it is below the inguinal ligament, and in the upper 1/3 of the thigh it is present. Okay, this is the femoral triangle. It can be asked for 5 marks or even 3 marks. The boundaries, the definition, the contents, the diagram, and it's okay. So yeah, what are the boundaries? So the boundaries are the lateral, okay, the lateral, medial, base, apex, and the roof of the femoral triangle. Okay, first we will see the diagram so that it will be easy to understand the written points. Okay, so this is the base of the triangle, this is the apex of the triangle, and this is the lateral border, and this is the medial border. Okay, on the apex there is presence of, it is formed by the inguinal ligament. Okay, it is formed by the inguinal ligament, and on the lateral side it is the medial border of the sartorius muscle. Okay, the sartorius muscle. If it is lateral, if it is on the lateral side, just remember the medial border will be used, and for the medial side the lateral border will be used. All right, on the medial side we have the lateral border of the adductor longus muscle, and the apex is formed by the crossing of two muscles, that is the crossing of sartorius muscle and crossing of the adductor longus muscle. So see, we saw the base formed by the inguinal ligament, the lateral by the medial border of the sartorius, the medial by the lateral border of the adductor longus, and the apex by the crossing of the sartorius muscle, and then the sartorius muscle and the adductor longus muscle. I think we did some blunder over here. Let me minimize it. Oh shit. Yeah, let me place it here. Okay, let me delete it as it is already over, right? Yeah, so see, we already saw that laterally by the medial border of sartorius muscle, medially by the lateral border of adductor longus muscle, base is formed by the inguinal ligament, apex is formed by the point where the muscles cross each other, and the roof is formed by the skin and the superficial fascia and its contents. In the previous video we saw that the superficial fascia of the thigh contains cutaneous arteries, nerves, lymphatics, and vessels. Like we have seen that in the previous video. If you haven't seen, please go check that video out because it's very important. Okay, so yeah, let me take all of this out. Yeah, so now we are going to see the floor of the femoral triangle. What is the floor of the femoral triangle formed by? So remember, it is formed by the muscles. Okay, these are the 4 muscles, 1, 2, 3, and 4. So the mnemonic for remembering these muscles is I play piano always. Okay, because I always play piano, so it is I play piano always. I for iliacus, P for psoas major, and again P for pectineus, and A for adductor longus muscle. So these are the muscles, 4 muscles that are, these are the 4 muscles that are forming the floor of the femoral triangle. To the lateral most we have the iliacus, then we have psoas major, then we have the pectineus, and then the adductor longus, which is which attaches to the it attaches to the medial border of the triangle. And for the lateral we have this sartorius. For this we have the inguinal, and this is the point where both the muscles cross each other. So the muscles, floor muscles, are iliacus, psoas major, pectineus, and adductor longus. I already told you how to remember it. I play piano always. Okay, you can also make your own mnemonics to remember it in a better way. Okay, so now we are going to see the contents of the femoral triangle. Okay, so we are going to see the contents of the femoral triangle. Let me delete this because we did a blunder at the beginning of the video. So okay, so see here, this is the transverse section. Okay, so this orange color or the brown color, whatever the circles the shapes are there, those are the muscles. Okay, so see, this is the sartorius muscle, the iliacus muscle, the pectineus muscle, the adductor longus muscle, as we had studied we had studied it. Okay, in the floor muscles of it. Okay, and then this is the purple color that you see here. This is the femoral sheath. Okay, we are going to study it in this video itself under the subsequent topics. Okay, so see, this is the pectineus muscle, this is the adductor longus, this is the iliacus, and this is the sartorius muscle. So this one here is the femoral sheath, inside which the femoral artery, the femoral vein, and the lymph node of the femoral canal pass in the femoral sheath. Okay, and this is orange. This, whatever you see here, is the skin. This is the superficial fascia and the deep fascia, and then we have the cribriform fascia that we had already studied. What is cribriform fascia? It is modified superficial fascia of thigh that covers the openings of the sphenius muscle, sphenius opening, right? So it is the modified superficial fascia which covers the sphenius opening. Okay, and see, inside, don't get confused between these two things, that there are two nerves. One lies inside the femoral sheath and one lies outside the femoral sheath. So inside the femoral sheath we have the femoral nerve of genitofemoral nerve. Okay, the femoral branch of the genitofemoral nerve. Okay, there is a genitofemoral nerve, so its branch is the femoral nerve. It is inside the femoral sheath, and the outside, which is present outside, is the femoral nerve only. It is not a branch, it is a femoral nerve, and this one is a branch of the genitofemoral nerve. Okay, just remember this. And these are the contents of the femoral triangle. In examination you can draw the diagram and then elaborate it by writing into writing it down. The contents are over. Okay, now we are going to study the femoral sheath. The femoral triangle is over. Now we are seeing the femoral sheath. Okay, what is femoral sheath? It is a funnel shaped sleeve of fascia. Okay, it is a funnel shaped sleeve of fascia. Okay, so the femoral sheath, it is a sleeve, okay, that is present for covering or holding the structures. Okay, it covers 3 to 4 centimeter of the femoral vessels. Okay, it covers these, and it is asymmetrical, and it has two walls, that is a lateral wall, that is a vertical, and medial wall is oblique. Just remember, suppose this is the thigh. How to remember this? This is how I remember. Okay, this is the thigh lateral side, and this is okay, it's not like that, but it's like this. Okay, so this is the lateral side of the thigh. So the lateral wall is vertical, see, it is being vertical, and the medial wall, it is oblique. See here, this is oblique, right? This is some bulging, so there's oblique. So, and this is one is the vertical. So the vertical wall, the lateral wall is vertical, and the medial wall, it is oblique. Okay, now how does the formation of this takes place? Okay, see, formed by two layers of fascia of the abdominal wall. Okay, fascia of the abdominal wall, it is formed by the fascia of the abdominal wall. So the two layers are the anterior layer and the posterior layer. Okay, the anterior layer is called as the fascia transversalis, and the posterior is called as the fascia iliaca. Okay, just remember that the hip bone has the ilium, so it is present on the slightly posterior. So just remember that the fascia posterior, the posterior fascia, that is the fascia iliaca, and on the anterior it is the fascia transversalis. Okay, so it is formed by the abdominal wall, fascias of the abdominal wall, that is the anterior and the posterior, and these are the names of it. Okay, inferiorly it merges with the femoral vessels and the connective tissue. We all already know that it contains the femoral vessels. Okay, it merges with the femoral vessels, and and connective tissue. Okay, so these are the compartments. So the compartments of this sheath are divided into the lateral compartment, the intermediate compartment, and the medial compartment. Okay, so you should remember in which compartment which vessel is present. Okay, so see, in the lateral we have the femoral artery, in the intermediate we have the femoral vein, and in the medial most we have the lymph nodes. Okay, and beside the artery or just below the artery we have the femoral branch of the genitofemoral nerve. Okay, as we have seen it upside. So it is divided into three compartments, that is the lateral, intermediate, and the medial. So it contains artery, vein, and the lymph node, and one nerve, that is the femoral branch of the genitofemoral nerve. And note that it is not the femoral nerve, it is the femoral branch of the genitofemoral nerve. All right, now we are done with the femoral sheath. We are going to go to the femoral canal. Okay, what is the femoral canal? It is the medial part of the femoral sheath. Okay, we have seen the femoral sheath. The medial part of the sheath itself is called as a femoral canal. Okay, it is conical in shape and its base is directed upward. As we saw that the base of the femoral triangle was also directed upward, and the conical and the femoral canal, its base is also directed upward. Its dimensions are 1.5 centimeter to 1.5 centimeter. If you can remember it, it's good. If not, then no worries. Okay, now the boundaries of the femoral canal, it is bounded by the anteriorly, posteriorly, laterally, and medially. First we will see the diagram, which will be very easy to understand, and once you draw the diagram it will be very easy to write and elaborate it. Okay, and get marks easily. So see here, this white color, whatever you see here inside, this is the femoral canal, and around this is it is the medial part of the sheath, right? The femoral sheath. So okay, this is the femoral canal, and on the anterior side we have the inguinal ligament. On the anterior side it has the inguinal ligament. On the posterior side there is a muscle, that is the pectineus muscle. On the lateral side we have the femoral vein, and on the medial side we have this ligament called as the lacunar ligament. Okay, someone is banging the horn. Okay, so fine. Anteriorly the inguinal ligament, posteriorly the pectineus muscle. How do you remember? See, posterior, P for posterior, and P for pectineus muscle. So posteriorly pectineus muscle, anteriorly there's a ligament, that is the inguinal ligament, and on the lateral side we have the femoral vein, on the medial side we have the lacunar ligament. So these are the boundaries of the femoral canal, and we are done. Thank you so much. In the next video I'll tell you what we are doing. In the next video we are doing the muscles, we are doing the nerve supply to the muscle, the action of the muscles, the origin of the muscles, the insertion of the muscles. We're going to do this, and in the next video, in the upcoming video for this chapter, we are going to do the femoral artery, femoral nerve, and the femoral nerve and the femoral vein. We are going to do this. So this section is very important for the exam. It can be asked for 10 marks or 5 marks or even 3 marks. So we are going to pressurize on this topic, and in the last video we are going to do the clinical anatomy of the whole chapter with mnemonics. Okay, so I'll be posting that very soon, so please make sure to watch the video. You have already seen the video. Okay, I should have told this earlier, to watch the video in 1.75x or 2x, but it's okay. I hope you have done that. So this is all about the femoral canal, the femoral sheath, and the femoral triangle, its boundaries, its contents, its diagrams, its definitions. So everything is covered in this video. Thank you so much for watching this video.